This podcast is Module 15, the concept of oxygenation, and we're going to be looking at assessing the lungs and the thorax. Here are the concept learning outcomes. Please review oxygenation and respiration from your A&P. This is just the very basic, the exchange of oxygen for carbon dioxide. So preventing lung problems, respiratory problems, making sure that we're avoiding airborne irritants, cigarette smoke, pollen, chemicals, pollution, infectious illnesses of the respiratory tract such as a common cold, flu, pneumonia, TB. Hemoglobin disorders such as sickle cell are going to also cause problems with the respiratory tract because there's not enough hemoglobin to carry oxygen to the brain, or the hemoglobin is misshapen and not able to carry the oxygen. Management of environmental air quality, we all should be very cognizant of that. Vaccinations, very important. Some modifiable risk factors that we can look at. Anything that affects the heart's ability to circulate blood, such as hypertension, atherosclerosis, are things that we can modify, maybe with medications, diet, exercise. Obesity is another one that puts extra stress on the respiratory system and oxygenation. Type 2 diabetes, smoking, stress and anxiety, all of these are modifiable. We can do something about these. So in class, bring your practice rubric for the thorax and the lungs. You're going to collect subjective data, what the patient tells you. Objective data, we're going to also observation during the initial interaction. Is somebody having difficulty breathing? Lifestyle behaviors. Do they smoke? Where do they live? Do they have allergies? Do they feel safe? Okay, so your assessment. Again, we're going to do this in class. You want your history and physical, and we will talk about the types of questions to ask. We want to inspect the thoracic cavity. We want to make sure that we're not seeing accessory muscles being used for breathing. We're going to look at the trachea, make sure that it's midline, that it's not displaced to one side of the neck or the other. Palpation, we're going to palpate the posterior and anterior chest, making sure that there is no abnormalities, no crepitus, no tenderness, no lesions. Then we're going to auscultate, and what we're going to do is you can click on the links below. The first one is normal versus adventitious breath sounds. So normal sounds should sound like air moving in and out very easily. Adventitious breath sounds are going to be anything that is abnormal. So at this point in 142, you don't need to be able to identify crackles or rails or rhonchi, wheezing. All you need to know is that it's not normal, that there are adventitious breath sounds. Let's look at this easy auscultation real quick. Alright, so we want the vesicular or normal breath sounds. Okay, very easy, very clear, in and out. Then these adventitious breath sounds, I'll just click on rhonchi, for instance. Okay, you hear that real rough, almost not crackling, but very low-pitched wheezing. Let's take a listen to wheezing. This is a real high pitch. And then some crackles. Okay, so that just gives you an idea of some abnormal lung sounds. Again, just being able to distinguish between normal and abnormal or adventitious. You want to make sure that you're looking at the client presentation, the posture of your patient. We're going to talk about this in class, but there's a tripod posture that you may see your patients taking it pretty much bending over or resting on a table to be able to breathe more clearly. Noting if they have any difficulty breathing, if they have a raspy voice. This YouTube is going to show you some retractions. If you can see, this child is using abdominal muscles to breathe, and we're also seeing retractions in between the lungs. So this child has a chronic lung disease, and it let me cancel this. And it's causing him to actually struggle to breathe. So he's using abdominal muscles, and we can see those retractions in the ribs. We're going to look at the skin color and the nail beds. The skin color should be nice and pink, normal for ethnicity. If somebody does have a problem with oxygenation, their skin may look a little bit blue, it may look a little bit dusky, a little bit gray. And also the nail beds. Remember when we talked about assessing the nails, they should have about 160-degree angle between the nail bed and the finger. Anything that is 180 degrees or more would be clubbing. Oxygen saturation, it can be documented as SpO2 in a percentage, and we're going to be testing that with our pulse ox. This is the amount of circulating oxygen in the blood, and most normal healthy adults will have a number in the high 90s or even 100%. Somebody with COPD, their normal oxygen saturation could be in the low 90s or even 89 to 90%. So we'll talk a little more about that in class. Okay, so where are you going to put your stethoscope? These are the places you're going to put it, and the same places that you're going to palpate for any tenderness, any crepitus. So you're going to do the front or the back first, doesn't matter which. And if you'll notice the direction of the arrows, they're doing two up at the top. Yes, your lungs really do go way up there to the top. And you're comparing sides. So you're going to compare the left side and the right side at level A. Then you're going to come down to B and make sure that you're not having your stethoscope over the scapula. You're going to compare that site. You're going to compare left and right, and so on down to C, D, and E. E needs to be a little more around the side of than directly down from D, so that we can get the base of the lungs. We're going to demo that in class and work on that in class. So this just gives you a visual of what you're going to be doing, where you're going to be putting your stethoscope, and documentation. So take a look at this, and we will be practicing this. So bring your practice rubric, bring your stethoscope, and we'll be practicing this in class.